Identifying health risks. Influences on health. Two babies are born on the same day in the same city in the United States. Which baby will live longer? Which will have a higher quality of life? To answer these questions, you would need to consider the different factors that influence a person's health. Factors that can influence health include heredity, environment, media, technology, healthcare, and behavior. Heredity. To some extent, your level of health is already determined at the time you were born. This is because of your heredity. All of the traits that are passed biologically from parent to child, traits that you inherit can affect your health. Your skin color, for example, can affect your risk of developing skin cancer. With fair skin, you have a greater likelihood of developing skin cancer than if your skin is dark. Another example is breast cancer. Some women inherit a higher risk for this disease. Even if you inherit a risk factor, you can lower your overall risk by avoiding other risk factors. If you have fair skin, you can be sure to use sunscreen. Women who inherit a risk factor for breast cancer can choose not to smoke because smoking is another risk factor for breast cancer. Another part of your heredity is your gender. Gender, whether you are male or female. Gender can influence your health because risk factors may vary between males and females. Physical environment. The environment is all of the physical and social conditions that surround a person and can influence that person's health. Your physical environment includes both your outdoor and indoor surroundings. The quality of the air you breathe and the water you drink are important to your health. So is your exposure to disease-causing organisms, to loud noise, and to radiation from the sun and other sources. Being aware of the potential risks in your physical environment can help you protect your health. If you know that breathing in smoke exhaled by a smoker increases the risk of lung cancer, you can try to avoid secondhand smoke. If you know that loud noises damage your hearing, you may be more likely to keep your music at less than harmful levels. Social environment. Your social environment includes the people you spend time with, your family, friends, classmates, and other people in your community. Most people learn their first basic health lessons from their family. Wash your hands before you eat. Brush your teeth before going to bed. Look both ways before crossing the street. Family members also can have a major influence on your mental and emotional health. Your friends can influence your health in many ways. Friends who take too many risks can put a lot of pressure on you to do the same. Your social environment is healthier when you choose friends who show concern for their own health and yours. Culture. A person's culture is part of his or her social environment. Culture is the beliefs, patterns of behavior that are shared by a group of people and passed from generation to generation. The group may be a nation, a region of a country, or an ethnic group. Some aspects of culture can influence your health. One example is the foods you choose to eat. In some cultures, people eat little or no meat. In others, meat is the main part of the diet. Another example is the way you show your emotions. In some cultures, public displays of emotion are typical. In others, people tend to keep their emotions private. Media. How much time each week do you spend watching television, listening to music, playing video games, or going to the movies? Do you read magazines or newspapers? What all of these activities have in common is that they involve media. Media are forms of communication that provide news and entertainment. You may not realize that media can have a positive or negative influence on your health. Think about television, for example. An average teen spends about 20 hours a week watching television. How can a television have positive influence on your health? You might receive useful information from a public service announcement or from a news report on a health topic. You might learn about medical issue from television series or talk show. How can television have a negative influence on your health? The hours you spend in front of the television are hours that you are not exercising. You also are not relating to other family members or taking part in community projects. Some characters on television shows may be poor role models who indulge in risky behavior. Advertisers may present misleading claims about health products they want you to buy. Technology. Advances in technology help doctors to detect health problems sooner and improve the quality of life for patients. Many people use sites on the internet to learn about health topics that interest them. This approach requires caution and good judgment. Some websites provide accurate information about health. Others are filled with misleading or self-serving information. Be sure to consider the source of the information on a website and the purpose of the site. What is the goal of the people posting the information, and what are their qualifications? Spending many hours on the computer also limits the time for other activities, such as exercise. If you use the computer to meet new people, there is the risk that you will connect with someone dangerous. Healthcare. Your health is influenced by the healthcare that is available to you and your family. Healthcare includes the medical services provided by doctors, nurses, dentists, and therapists. Healthcare also includes the places these people work, such as clinics and hospitals. Some factors increase the likelihood that a person will take advantage of available healthcare. The service must be in a location that is easy to get to. The service should be open on weekends or evenings for people who can't take time off from work. Finally, people need some form of health insurance so that they can afford the costs of necessary checkups and treatments, including medicines. Behavior. Suppose that a friend came up to you and said, "A group of us are going swimming tonight at the lake after dark. Be ready at 8, I'll pick you up." What would you do? Would you go along without giving the things a second thought, or would you stop and think about the risks involved? Of all the influences on your health, the decisions you make and the actions you take often have the greatest impact on your health. Sometimes behaviors become habits. A habit is a behavior that is repeated so often that it becomes almost automatic. For example, you may have a habit of brushing your teeth after meals. This is a healthy habit because it helps prevent tooth decay and gum disease. You may also have a habit of staying up late watching television. That is not a healthy habit because it reduces the number of hours available for sleep. When you lose sleep, it is difficult to concentrate the next day. A repeated lack of sleep can make it hard for your body to fight off an illness or repair an injury. Unhealthy habits can be broken. When you find that you keep repeating a behavior that may threaten your health, you can set a goal to change your behavior. Your goal should include a plan for changing your habit. Such a plan often results. Your goal should include a plan for changing your habit. Such a plan often works best when you involve friends or family members for support. Evaluating health risks. Should you try the latest fad diet to lose weight? How do you decide? One way to think about the decision is in terms of risk factors. A risk factor is any action or condition that increases the likelihood of an injury, disease, or other negative outcome. For example, one risk factor of a fad diet is that it may not include all the foods that your body needs. There are 3 ways you can evaluate a risk factor. Consider both short-term and long-term consequences. Decide whether you can control the risk factor. Analyze the possible benefits and risks of the decision. Short and long-term consequences. Some behaviors can have an immediate effect on your health. You take a shortcut through an unfamiliar yard and end up with a nasty case of poison ivy. You don't buckle your seatbelt and get injured in a car crash. With some risky behaviors, the consequences are not immediate. Suppose you eat a mainly fast food diet, which is high in fats, sugars, and salt. People tell you that your diet increases your risk of developing heart disease and diabetes later in life, but you feel healthy and energetic, so why not wait until you're older to change your behavior? First, it can be very difficult to change habits that have existed for years, and even if you do change your eating habits later in life, you may not be able to repair the damage you have done to your body. Risk factors you cannot control. A friend invites you to the beach. You are worried because you have fair skin. You can't control the color of your skin or other risk factors that are part of your heredity. Nor can you control all the risk factors in your environment. For example, you may have less emotional support if someone you are close to gets ill and dies. Risk factors you can control. These are risk factors you can control. So what risk factors can you control? You can control risk factors that are related to your behavior. For example, you can control the exposure to ultraviolet radiation in sunlight and in tanning booths, which will reduce your risk of developing cancer. Or you can maintain the close relationships with many people. That way, if one of your relationships ends, you will still have emotional support. These are other examples of risk factors over which you have control. Your level of physical activity. So these are other examples